Hello to all. Today we will tell you what preeclampsia, pregnancy poisoning, is. Let's start. What is preeclampsia, pregnancy poisoning? What are the symptoms? Preeclampsia is a complication seen during pregnancy. This condition, it is a problem with high blood pressure that generally occurs with pregnancy. Pregnancy intoxication is more common after the 20th week, which coincides with the period after the second half of pregnancy. Treatment of preeclampsia can be carried out by lowering blood pressure, stabilizing complications, or removing the baby early. Watch the video for answers to questions such as what is preeclampsia, why it happens, how to treat it, and other details. Continue watching the video. What is pregnancy poisoning? Pregnancy poisoning is high blood pressure and elevated protein levels in the urine that occur during pregnancy. High protein levels can cause damage to other organs, especially the kidneys. Swelling of the hands, legs, and feet is the most common symptom. Preeclampsia is a serious condition that can endanger the mother and baby. Pregnancy poisoning treatment, symptoms of pregnancy poisoning. The most characteristic symptom of pregnancy intoxication is hypertension. This may also be accompanied by generalized edema, swelling. Pregnancy intoxication can also be detected in some women during routine pregnancy follow-up. In general, some of the symptoms of pregnancy intoxication are as follows. Rapid weight gain due to edema problems, some vision problems such as blurred vision, sensitivity to light, and temporary vision loss, pain in the right upper abdomen, shoulder pain, severe headache, nausea, and vomiting, dizziness, less urination, mental state changes, weakening of reflexes, elevated levels of protein in the urine indicating kidney problems, decreased levels of platelets in the blood, increased liver enzymes indicating liver problems, shortness of breath due to fluid accumulation in the lungs. What causes pregnancy poisoning? The cause of pregnancy poisoning is not entirely clear. However, some health experts have reported that this condition can be caused by anomalies in the placenta membrane, commonly known as the baby's mate. Problems related to blood vessels in the placental membrane can cause blood pressure problems in the expectant mother, posing a risk of preeclampsia. How is pregnancy poisoning diagnosed? Doctors use some medical evaluation methods for definitive diagnosis when pregnancy poisoning is suspected. Some of these methods are as follows. Blood tests. With blood tests, liver and kidney values are checked and blood clotting is checked. Urine analyses. Urine tests are used to analyze how well the kidneys are working. Fetal ultrasound. Fetal ultrasound is the monitoring of the baby in the womb by ultrasound. In this way, the baby's weight and the condition of the amniotic fluid are monitored. Non-stress test, NST, and biophysical profile. The non-stress test monitors the heart rate when the baby moves. The biophysical profile examines a number of parameters that help to determine the baby's well-being. What are other blood pressure problems during pregnancy? Blood pressure problems during pregnancy can also be caused by conditions other than preeclampsia. This can sometimes be caused by chronic hypertension that was present before the 20th week of pregnancy, and sometimes by gestational hypertension, also known as gestational hypertension. Gestational hypertension is a condition that occurs only during pregnancy, but does not lead to pregnancy poisoning. Preeclampsia. Does every high blood pressure cause preeclampsia? High blood pressure during pregnancy does not always lead to preeclampsia. High blood pressure may also be present in the pre-pregnancy period. In order for this condition to occur as pregnancy poisoning, a much higher blood pressure than normal should be seen in the 20th to 30th week of pregnancy, and high protein values should be present. What should blood pressure be during pregnancy? The blood pressure of a normal person is 120/80ths mmHg. During pregnancy, a slight increase in these values is considered normal. However, blood pressure 140/90 mmHg and higher during pregnancy may be a harbinger of gestational hypertension or other health problems, including preeclampsia. What are the risk factors for pregnancy poisoning? Risk factors for pregnancy poisoning include factors such as unhealthy diet before pregnancy, poor lifestyle habits, stress or health problems in previous pregnancies. In general, the risk factors for pregnancy poisoning are as follows. Pregnancy poisoning in previous pregnancies. Multiple pregnancy, getting pregnant for the first time, chronic high blood pressure disease, diabetes, kidney disease, autoimmune disorders, having undergone IVF treatment, obesity pregnancy, Age 40 years and over, less than 2 years or more than 10 years between the previous pregnancy and the current pregnancy. History of pregnancy poisoning in family members. What are the complications of pregnancy poisoning? Pregnancy intoxication is a condition that can lead to other unwanted problems. Among these, the serious ones are premature birth and infant deaths in the womb. Some of the complications seen in preeclampsia are as follows: paralysis, heavy vaginal bleeding after childbirth, developmental disorders of the baby, risk of premature birth, placental detachment, premature separation of the placenta from the uterine wall, HELLP syndrome, breakdown of red blood cells, eclampsia, condition similar to seizures or convulsions. Damage to other organs, cardiovascular disease. Does preeclampsia continue after birth? Preeclampsia is a condition that generally tends to improve 48 hours after birth. In many pregnant women with this condition, symptoms improve shortly after delivery. Liver and kidney values return to normal within a few months. However, preeclampsia can reappear 48 hours to 6 weeks after delivery, even if the rate is low. For this reason, blood pressure and blood values should be monitored regularly. Does preeclampsia harm the baby? Preeclampsia can harm the baby in the womb as well as the pregnant woman. The most common complication of this condition is developmental delay in the baby. This is due to insufficient blood supply to the baby through the placenta. In this case, the baby receives less oxygen and nutrients than it should. When does labor occur in pregnancy poisoning? In case of pregnancy intoxication, labor is delayed as much as possible. However, it is ensured that the baby is born in the 37th or 38th week to prevent the progression of symptoms and to prevent the risks associated with preeclampsia. This can be achieved by induction of artificial labor or cesarean section. Symptoms of preeclampsia. How is pregnancy poisoning treated? Treatment of pregnancy poisoning may vary depending on the severity of the condition. If the condition is severe, it can put the life of the mother and baby at risk. For this reason, doctors may decide to give birth for definitive treatment. However, if preeclampsia does not give serious symptoms, and the baby is in a good position in the uterus, alternative methods are used. Some of these methods are as follows: bed rest at home or in hospital, frequent monitoring of the baby's heart rate, use of drugs that lower blood pressure, regular monitoring of blood and urine values, steroid medicines to accelerate the baby's lung development, use of magnesium to prevent seizures in the mother. Can pregnancy poisoning be prevented? Pregnancy poisoning is not a preventable condition. However, risk factors can be reduced in some pregnant women. Whether there is such a risk can be determined by doctors who monitor pregnancy. Some of the measures to be taken to reduce the risk of preeclampsia in pregnant women are as follows: drug treatment. Medication is used in cases of moderate to severe risk of preeclampsia in pregnant women. The treatment, which is recommended by physicians and begins to be used after the 12th week of pregnancy, includes blood thinning medication. Lifestyle changes. Some bad lifestyle habits before and during pregnancy can increase the risk of preeclampsia. Some of the measures that can be applied to prevent this condition are as follows: keeping blood pressure and blood sugar under control, ensure weight control, quit smoking if you smoke, doing exercises suitable for pregnancy to create a healthy nutrition program. If you are pregnant and are experiencing some symptoms that indicate pregnancy poisoning, do not neglect to consult a health institution. Thank you for watching.